Live now. Let us start and move.
Is it live now?
Yes, you are live.
Thanks a lot. My dear viewers, I welcome all my viewers, those who are logging in from across India and those who are logging in from the RUD. We all welcome you on this very august platform of Education Pe Charcha. My dear viewers, today it is the 92nd session on Education Pe Charcha. And before I kickstart the session, it becomes extremely incumbent on our part, my dear viewers. You all would know that a deadly train accident had transpired, had happened in Balasore last evening, and in fact it has been the most severe accident ever since 1981, and it resulted in a heavy casualty. Almost 300 or more than 300 people had already perished, as it has been reported thus far, and more than 900 people have sustained a very severe injury. My dear viewers, Honorable Union Minister had reached the spot last night, and our beloved Prime Minister, Yashasvi Prime Minister of India, Sri Narendra Modi ji too, had reached the spot. He had visited hospitals and just to inquire about the updates of all those injured patients. So Prime Minister's sensitivity towards the citizens' injury, towards this very serious mishap deserves all sorts of salutations and kudos from Education Pe Charcha. My dear viewers, with a very heavy heart, I, Vivekanand, author, academician, and public intellectual, on behalf of my team of Education Pe Charcha, we all express our serious condolence, deep condolence for all those who perished in such a very macabre railway accident, and those who have seriously injured. We pray to Almighty for their immediate recovery. So this is, with this condolence, we kickstart our session, of course, with a very heavy heart, but the session has to go. Charai beti, as Upanishad says, life has to go on, life has to go on. My dear viewers, this happens to be the 98th session, and just we are on the verge of celebrating the centenary, that is on 17th of this month, when we have a very august guest, the former People's Chief Secretary of Bihar, today's Director General of in Bihar Museum, Sri Anjani Kumar Singh ji. But that is on 100th of session. Today, my dear viewers, we do have another very distinguished guest, because you all would appreciate the fact that here, by virtue of this Education Pe Charcha, which is very much synonymous with educating the nation, we have been trying to host the distinguished people with all sorts of myriad achievements to their credit. And today, in the continuation of the same sequence, we have invited one of the young, but indeed a very proficient, a very reputed pediatrician, Dr. A.K. Barmaji, who happens to be an assistant medical officer that is in Mekon Ispat Hospital here in Ranchi. Dr. A.K. Barmaji, in fact, the way I have known him, has been a very gentle face of that of medical profession. A man who is always economical in words, but of course, very generous in terms of in terms of extending the meticulous care to all the patients who make it a point to visit him for a proper advice, for a proper consultation. So Dr. A.K. Barmaji today happens to be our very esteemed guest, befitting the 98th session on Education Pe Charcha. My dear viewers, you all would appreciate this program of Shastrartha on, that is Education Pe Charcha, is conducted under the aegis of Drishti Talks, which is spearheaded by Sri Pramodji, who happens to be a valued partner, a technical collaborator of this Education Pe Charcha, and his gracious presence is sine qua non for the hitherto, not only for conducting the program, for the success, whatever quantity of success it has attained thus far, that is also Pramodji has also been a very important stakeholder in that particular case. My dear viewers, Dr. Sri A.K. Barmaji, who is a distinguished guest today, happens to be a very well-known pediatrician in Ispat Hospital in Mekong. And now I just welcome him. We very much welcome you, sir, Dr. A.K. Barmaji, with this very first question. The very first question goes to you, sir. You know, it goes in this way. Walking, and one thing I would like to make it clear, my distinguished viewers, today, since, you know, most of his acquaintances, or you can say the viewers, are from the Hindi background. So Dr. Saab has absolute discretion to communicate with me, to respond to my questions in Hindi or shuffling between English and Hindi, so as to make himself comprehensible to large section of his acquaintances who have already logging in, and who eventually will log in, will be able to understand him better. So I give him the absolute discretion to choose whichever languages he so decides. Question goes, sir, to you. Walking down the memory lane, if you could kindly share the details of your sophomoric year, that is student's years, culminating in your MBBS degree from MGM Medical College in Jamshedpur. Yes, Dr. A.K. Barmaji, we welcome you, sir, on this august platform of Education Pe Charcha. Please, your take.
Thank you very much, Vivekanand ji, for a nice introduction. Thank you for inviting me on this session of Education Pe Charcha. And I would also like to congratulate you for the centenary session, which is going to happen in next couple of weeks. First of all, I'd like to talk a little about myself. I belong to Bihar, basically, from a small village in Ara. My father was a ceramic engineer in Disco. He was a very noble person with high moral values. And some of his good qualities came to me. And whatever I am today, it's because of him. You are talking about, you asked about my student year. See, I was a bright student right from the beginning. As you know, all the doctors and engineers are usually bright right from the beginning. I finished my +2 examination from KMPM Inter College, Jamshedpur. I was born and brought up at Jamshedpur because my father was working in Cisco. After finishing my +2 from KMPM Inter College, I got admission in MBBS to admission test in Bihar admission test, the medical admission test. And but I had some health issues. That is why I stick to take admission in Jamshedpur. I had to take admission in Jamshedpur. Though I was getting admission in Patna also, but due to my health issues, I have to stick to MBBS from Jamshedpur only. So I finished my MBBS from Jamshedpur in the year 1998, and subsequently I finished my post graduation from Jabalpur in 2003. I had actually done MD, actually got the entrance through All India Medical Entrance Examination, and got the MD degree from there, from Jabalpur. And subsequently, after finishing my post graduation, I had to return back to Jamshedpur because of my familial obligations. I was getting to work in All India Institute of Medical Sciences, Delhi, also in pediatric cardiology. But due to my certain problems, I had to stick to my own place. And but I worked in Mercy Hospital for 2.5 years at Jamshedpur. And there I worked under Dr. B.R. Master, the legendary pediatrician from Jamshedpur. In fact, everybody knows Dr. B.R. Master. I have lost touch in recent few years. So I learned a lot from her. I used to sit with her in OPD in the indoors also, and I learned a lot from her. And after 2.5 years working there, I went to Bombay for 6 months. I was there in a hospital for 6 months. And after that, I came to Ranchi. And I am in Ranchi for last 17 years. I am serving.
We will come to it. Thank you, sir. We will come to it, of course, because we wanted to know, our viewers intended to know, or rather intended to unravel your sophomoric years, and indeed you already threw an adequate light, into your sophomoric years. Thank you, sir. Thanks a lot. Now I'm coming to the very next question. Though you just dropped a hint on it, but our viewers would like to know something in detail. So question comes here. You claim to have done your MD from NSCB Medical College, Jabalpur.
Yeah.
Indeed, by way of underscoring it, you already did it, but just in some details, even though it is not in comprehensive form, but nevertheless, by way of some details, our viewers would like to know about, your days, your years doing your MD there in that particular institute, and what sort of knowledge you collected from there, what sort of, that you applied in subsequent years as a pediatrician. So all this, please, sir, your take now.
NSCB Medical College is in Jabalpur. Jabalpur is a very nice place, very peaceful place, in fact. And when I went there during my first year, I had undergone extensive training. We were working for around 20 hours a day. Sometimes we had to work 48 hours continuously. Especially in neonatal units, we had to work for very long duration. Our duties were posted in such a way because we were very few residents initially. So there I learned a lot in neonatology. And in pediatrics part, I had Dr. Bhardwaj. He was a pediatric endocrinologist. And in the pediatric endocrinology, I learned a lot from him. Various kinds of patients were coming to us, especially patients of various endocrine glands, disorders of endocrine glands, the stunted children who were having growth hormone deficiency, then patients of adrenal gland deficiency, and so on and so forth. There were so many patients. So I had to, I worked under him and I learned a lot from him. Our HOD was Dr. Maya Chanturia. He is a well-known figure in that region. Dr. Shingwaker was another stalwart from Jabalpur. In fact, he was from Indore. And subsequently, he moved to Jabalpur. So, in conventional pediatrics, he was a mastermind, especially in malnutrition, anemia, and all those topics. So, I learned a lot from all these people. And we had postings in other wards also, especially ICU, anesthesia, and other wards also. So there also I learned a lot from them. Actually, I had married in 1998, and I had my first issue in 1999. And my son was a special child. Actually, unfortunately, he had mental abnormality. So my wife was also staying with him at Jabalpur in those days. And Jabalpur helped me in upbringing my child also. And now my child is 24 years old. And I had, not only me, my wife also, both of us had to restrict ourselves because of my son as well. So overall, in Jabalpur, I learned a lot academically, and Jabalpur helped me in my familial problems, to deal with my familial problems as well. The professors were very, very helpful with regard to my child's treatment also. They in fact sent me to Bombay for further treatment and for further presentation. So in that way, I had a very memorable experience of Jabalpur, and I still remember that place very well.
Great, great. Indeed. My dear viewers, just to share my own personal, my personal rapport or whatever I gathered about Dr. Saab, in course of my own interaction, what I saw, whoever, means whichever child comes to him or goes to him for treatment, he is very meticulous care. Yeah, and I must tell you one thing, what I've seen in doctors, that the way, as and when some patients visit doctor, the first thing, or you can say the immediate balm that doctor can apply upon the patient is the way of their conversation. The very soft spoken Dr. Srivastavaji, is, applies the balm at the very moment a patient enters into his chamber. The soft spoken, gentlemanly doctor, himself, it is a first cure to the patient. And then subsequently he diagnoses after understanding the problem, and prescription of all medicine follows. But the very first thing, because often we see the doctors who are jittery, they do not give much of importance to patients, and they get rankled just with a momentary interaction. They don't listen to the patients with all sort of patience. So all these sort of characteristics are absolutely conspicuous, are absolutely absent so far as our Dr. Verma ji is concerned. So of course the sort of educational traits or characteristic traits which he has inculcated in himself in Jabalpur as well as in Jamshedpur, all that cumulatively contributed towards his blossoming as a doctor, as a very comprehensive, or you can say as a very consummate pediatrician. That is his personality itself, vouches, or itself is a living testimony to all that what he had spoken thus far. Thank you, Dr. Saab. Thanks a lot. Coming to the next very, very important question. You worked as a registrar in Mercy Hospital, Jamshedpur. So if you could apprise our viewers about the role of a registrar in pediatrics department. Please, sir, your take now.
Yeah, registrars are basically whenever a doctor completes his post-graduation, after that initially he works as a registrar and then senior registrar, and then he moved to the faculty position. So I was initially posted as a registrar in Mercy Hospital, but I had a lot of responsibilities. I was looking after all the patients, and in fact there we had all sorts of very bad patients, you can say. They were coming. All patients like patients for birth asphyxia, severe birth asphyxia, the patients coming with severe malnutrition, the falciparum malaria, various types of malaria. In fact, I have seen the classical hemoglobin urias in falciparum malaria at that place only. And so many patients I have seen. So I had to take care of them right from the arrival in the hospital to the discharge. I had to prepare the discharge also. And I was enjoying my duty there very well. The consultant who was there, she was Dr. Brani Dev. She was, she was not talking to the patient also. Talking to a patient, a doctor talking to a patient, explaining the prognosis and the problem of the patient is also an art. So I learned that art there very well, because I had to deal with all the patients, and as such, as very bad patients were coming there as well. So there were many, mortalities also. So I had to console the parents. I had to, many times very bad patients were coming. They were asking, should we take out of Jamshedpur? Should we go outside? So I had to convince them, your child can be treated. In fact, there was one child I remember. That child was of fulminant hepatitis. The child came with severe jaundice, hepatitis, and he was unconscious. And it was following the use of certain drugs which control the epilepsy or the seizure. So it was a side effect of that. So that party I had to convince a lot, and because they were very, very much frightened whether my child will be alive or not. The condition of the child was very bad. What should we do? Should we take outside? But I convinced them, have faith on me, and gradually, by the grace of God, the child survived, and the whole family was very, very happy. And they are still, I think, they are not in contact, but they must be remembering me right now as well. So simultaneously, as I told you, Dr. B.R. Master was there. She is a legendary figure in pediatrics. And I learned a lot from her. She was regularly coming to our hospital as a visiting consultant, and I was sitting in OPD with her. I was doing indoors as well with her, and there I learned a lot from her. Managing traditional ways of treatment, also managing advanced and modern ways of treatment, also. So all those things I learned there in my initial days, which is essential when you finish your post graduation. It is essential to work at a place where you should try to learn for initial 2 to 3 years. So there I learned a lot, and after Nursery Hospital, I went ahead in my career. I went to Bombay, and subsequently I came to Ranchi. But Mercy Hospital, still I remember there I was regularly presenting papers, and
So that will come to it. Dr. Saab, we'll come to that. We'll come to that. Thank you.
yeah,
Thanks a lot.
yeah.
So, fantastic. Of course, my dear viewers, our very, very distinguished guest has shared his varied experience, which he has collected right from Jamshedpur as well as to that of Jabalpur. And then again, he went to Mumbai for 6 months trading, whereunder he claims to have picked up a lot of skills, which subsequently came to, came to his relief, or added value to his overall skills, because he went on applying all those skills here in his path, Mekon Hospital too. And he had, the way he had convinced the guardian of the patient who was suffering from epilepsy at such a very tender age, that itself deserves kudos, because often the guardians become extremely violent because unable to bear the pain, or because excruciating pain of the children, they often tend to become violent. And then a doctor's persuasive skills also comes handy in delicately persuading such violent guardians to calm down and to begin trusting the doctors. That itself is a very, very delicate task, which Dr. Barmaji has been very skillfully handling. And that deserves kudos, because as I already introduced him in the beginning, he's already assistant medical officer, and we already hope that, and we do have the optimism, sense of optimism, that under his stewardship, the Ispat Hospital too will blossom further. It will traverse even far greater distance. Thanks a lot, Dr. Saab. Coming to the next hospital, sir. You also claim to have worked as specialist medical officer in pediatrics in NPCIL Tarapur. If you could kindly share your experience, in Tarapur Hospital with our viewers. Please, your take now.
Yeah, this was, I remember I worked there for a short period of 6 months. And there I learned basically newborn care in ICU. I worked in ICU and advanced care in neonatal intensive care unit, basically dealing with newborn babies, the advanced neonatal care in the form of ventilators, use of ventilators, DFG machines, and other advanced machines. We were regularly seeing those cases, and under the guidance of certain intensivists who were present there, I learned a lot in neonatology. Further, whatever I was learning, it added to my knowledge and added to my experience. And subsequently, after some time, I felt that after 6 months, I felt that I should return back to my area, either going to Jamshedpur or going to Ranchi, because both of these are my places. So I finally decided because I was selected here, I gave an interview, I was selected here. Subsequently, I moved to this place. So Tarapur was a very pleasant experience, and I learned a lot in neonatology.
Great, great. Straightway, sir, coming to the next question, because it is your current designation, it is your current position. You are working today in Ispat Hospital, Mekon, as a consultant pediatrician and assistant chief medical officer, Mekon. Your experience in the above position, if you could kindly share with that of our viewers, sir, because Mekon is a very reliable hospital and it has been catering to the varied patients for so many decades together. So you are already in the capacity of assistant medical officer and a very well established pediatrician. Please, your experience will help a lot of viewers. Yes, sir, you take now.
Yeah, I joined here in 2006 August, and initially I joined as a medical officer, and subsequently I came on to become consultant in pediatrics, and simultaneously I'm holding the post of assistant chief medical officer. Actually, it is just below chief medical officer. Chief medical officer is the topmost post here. The kind of patients that I'm seeing in Mekon, is a consultant organization, consultant engineering organization. So, all educated and intellectuals are there. So, the kind of patients at this place is initially I found was quite different from what we had experienced earlier in medical colleges or at subsequent places, because we were getting mostly patients who were little bit educated, not that much educated, and some literate people are also coming. So, literate people and intellectuals usually nowadays also, patients, when they come to us, the parents are usually they have some idea of the disease because they are internet savvy and usually look into the problems in the internet also. So, the kind of patients that we see, we have to tackle in a little different way. So I had a little different experience here initially, and subsequently, uh, I was accustomed to this place, and I saw very good cases here. In fact, it's a very small community. Uh, Patients from other places are also coming. Non-entitled patients are also coming. Not only patients coming from one organization, but other public sector patients are also coming, and patients are also coming from outside. In fact, coming from remote places also. Patients do come from quite remote places to me as well for consultation. So here, the kind of patients that I have seen in a very small community, varied kind of patients have come. In fact, many cases of malignancies, brain malignancies, brain tumors, I have diagnosed many cases. I have diagnosed many cases of common cases of tuberculosis and all. They are in fact coming. The cases of, one case I still remember, was of an engineer from Mekon, and she had a tumor. And in fact, I diagnosed that case, and she had a very rare tumor. Subsequently, we tried to operate him, but we could not operate because it had encroached very vital organs. So here I had a different kind of patients, and we have to deal with such kind of patients. I had initially a little bit of problem, but subsequently, I was accustomed to this place, and now the patients are very friendly to me because most of them know me, and those patients who come from remote places, they also get satisfied after coming to my OPD. And if you want to share my experiences on some cases, I can share some cases also, if you permit. And presently, I'm holding the post of Assistant Chief Medical Officer because I have other responsibilities as well. I have to look after the medical stores as well, because that is an important part of the hospital. And I look after the continued medical education programs also. and I regularly do continue medical education programs here. I have presented many scientific papers here. So that's it. If you permit me, I can share some my experiences with you regarding.
Great, Dr. Saab. Thanks a lot. You narrated, you just shared some very, very important experience. Thanks a lot. I'm straightway coming to the very, very next question. Very important. You claim to have presented papers in ASMOC, AISMOC 2013 and 2015 Jharkhand, Pedicon and Jharkhand Pedicon 2004.
Yeah.
What sort of papers you purportedly claim to have presented? If you could kindly explain the same to our viewers, albeit in layman's parlance, because we are non-medical people and you would
Yes,
appreciate your please, sir, your take now.
yes. First, I'll talk about a paper that was a paper related to social pediatrics, knowledge, attitude, and practices among mothers, interns, and nursing women before and after counseling. You know, neonatal care is a very important part of our society. And in fact, our society, you say Indian traditional way of dealing in every home. You know, initially when the baby is born, the baby with mother are said to be not pure. So they are kept. We say कि उनके पास नहीं जाना. That is a normal Indian tradition. Initial first week at least. So this is very, very scientifically, it is very, very, proven that if you isolate mother and baby unit initial for 7 days, this is going to be very much beneficial because the baby's chances of getting infection and other problems will be drastically reduced. So my paper was basically a social pediatrics related to newborn care. I had a number of questionnaires related to the neonatal growth. In particular, what should be when a normal newborn is born, what kind of oils should be applied, what kind of bath soap should be applied or not, when they should be given this neonatal bath, and what are the common ailments that newborns present with, like newborn rashes. There are some other conditions which are called nephritis syndrome and so on. So basically, what I did, I had actually got the information before counseling from lay mothers and interns and nursing staff. And subsequently, later on, I gave a counseling regarding various issues related to newborn care. And after that, I had another session of questionnaire. So, and then I compared the impact of my counseling on their knowledge of newborn care. So that was my paper which I presented in this curriculum, and the impact of counseling was dramatic. You know, especially mothers, they're not knowing that much regarding newborn care, and the impact of counseling had a very, very positive impact on that. And not only mothers, in fact, nursing staff, and in fact, interns are actually those students who have just finished their MBBS and doing internship. So they also didn't have much knowledge about newborn care. So basically, my paper was related to that, and that was the paper which I presented. The other paper which I would like to share about is that I presented in ASMOC was that of on obesity. You know, childhood obesity is a very common problem nowadays. We see in our OPD so many cases of obesity, obese children coming to us. You know why this obesity? In fact, out of those children, there is hardly any case which has an organic reason behind it. Organic reason means there is some pathology, some problem in an organ which can result in obesity. So normally there is no pathological reason. it is only either the genetic reason that because the parents or the grandparents are obese, that is why the child is also obese. So either there is genetic reason or the other reason, which is which is bad food habits nowadays. The children are taking a lot of these pizzas, pastries, and all those things, which are very high in calories. And on top of intake of that high calories, the calories are not consumed properly, because nowadays the children are not going for outside for outdoor activities. These mobile phones, internet, and these computers, all these have restricted the children to stay indoors. So what happens? The energy that they have consumed, this is not being spent. So what happens? This energy will be stored in the body. So this energy gets stored in the body in the form of fat, and subsequently it evolves into obesity. The parents don't realize initially that their child will be developing obesity later, so they don't care initially. But later on, when the child becomes doctor obese, then they are scared, and then they move to the doctor when the condition goes out of hand. So, obesity is in children especially can predispose to a number of various diseases. In medical terms, we say a term called metabolic syndrome. Especially truncal obesity is related to metabolic syndrome, a condition in which also includes your diabetes mellitus. Previously in children, mainly the cases of diabetes that were coming were insulin dependent. That means the body lacks insulin, so from outside we were giving injections of it. But nowadays, these children are coming up with the type of diabetes that is seen in adults, the non-insulin diabetes mellitus. The incidence of non-insulin diabetes mellitus in children is increasing in numbers. And the reason is, one of the very important reasons is obesity. So obesity, childhood obesity, I had presented this paper in asthma in 2013 probably, I remember. So these were the some of the papers which I have mentioned here that I had presented that time. And that's
Great. Great, Dr. Saab. I'm straightway coming to a very important question, because you would appreciate the time constant. So this is the next question straightway, and hereafter again one more question will be there. You also claim to have conducted MediQuiz in ASMOC 2010 and 2017. If you could enlighten our viewers about the technical significance of the same, please, sir, your take on this.
MediQuiz is actually quiz that is being taken for MBBS doctors, for graduate doctors. In 2010, we have conducted here in NTI during asthma. In 2017, again in the same auditorium. The purpose of MediQuiz was to not only to improve the technical knowledge of the doctors, but also to have a good interaction with the audience. Most of these audience are doctors in the conference, and we have a very good interaction between them. To conduct a MediQuiz is a very, very difficult task, because you have to prepare the questions and clinically relevant questions especially, and you have to look into all the technical details also. You know these buzzers and all these things. So I had made a lot of efforts in both the conferences, and it was a very, very successful MediQuiz. In particular, 2010 was very, very successful. And all the stalwarts that came, the companies were very happy.
Fantastic. Indeed. Of course, you are, all the programs that you have taken Definitely, they attained a lot of success, and you have been acclaimed for conducting medical. No denying the fact. The sort of impeccable reputation you enjoy today, of course, owing to all these sort of myriad programs that you conducted with a tremendous, with a thriving success at your end. There is no denying the fact. Sir, I'm coming to a very important and, of course, last question. You have been regularly conducting and presenting CMES at Ispat Hospital as in charge CME program. Kindly apprise our viewers about the technical nomenclature of it, nomenclature as well as its significance to our viewers in layman's parlance. Your take now, please.
Continued medical education programs are educational programs for doctors. These programs are actually done to improve the medical knowledge, because medical is an evolving branch, ever evolving branch. Any doctor cannot claim that he has knowledge of all the medicine. So these CMEs have to be done regularly, on regular basis, to improve the clinical acumen and the medical knowledge what the doctors have. So these continued medical education programs are very, very essential. Doing CMEs, doing workshops. Workshops are being done to demonstrate. In fact, we do the audio visual sections also. There we do audio visual sections also in workshops. So these programs are actually to improve the technical knowledge, to improve their technical acumen, which will help in their clinical practice. Those doctors who are doing say post-graduation, or those doctors who are MBBS doctors working at various district hospital levels, or let's say CHC level. So it is very essential to do CME programs. In fact, CME programs, we all are attending regularly CME programs and workshops to improve our knowledge as well. Because the medicine is an ever-evolving branch. New medicines are coming up, new technologies are coming up. Now the robotic surgeries have come up. The surgeries are being done by the robot. The neurosurgeries, the heart surgeries are being done by the robots. This is all due to technical advancement. I must thank the engineers also for developing such good, machines for us. In fact, without machines, we cannot really treat patients nowadays. Advanced treatment is not possible. We have excellent machines available, which are there for major surgeries. Major surgeries are being carried out, with these advanced machines. So, continued medical education programs is to apprise the knowledge of the doctors. And when I had come here, the medical education programs were not being conducted regularly. So I became the in charge of medical education programs, and I started doing continued medical education programs here, and I am doing it regularly. And whenever I find that even very few of them are present, I still do these programs, because it not only improves the knowledge of the listeners, but also it freshens up my memories also regarding the disease or any medical topic that I'm presenting. So that's it.
Great, Dr. Saab. My dear viewers, today, in fact, it was a very, very enlightening interaction between me and Dr. Sri A.K. Barmaji. And of course, it is going to be extremely helpful and beneficial for all those who have been eventually logging in with us, and those who will, who have been hitherto logging in with us, and those who eventually will view this program. Definitely, they will find an authentic benefit to their oceanic benefits, because all sort of information and knowledge explosion in that of an interaction between me and Dr. Sri A.K. Barmaji. My dear viewers, just before I ask, I invite intellectually enlightening conversation, it becomes incumbent on my part to make an announcement pertaining to our next guest. It is Sri Rizwan Khan, who was the state president of Hajj committee former president of Jharkhand of Hajj committee and a member of the National Muslim Rashtriya Sangh. He is going to be our distinguished guest on coming Saturday, that is on 10th of June 2023. Now it is a time for Sri Pramod ji to sum up our very, very intellectually scintillating conversation in Hindi. Pramod ji, please. Adarniya Pramod ji.
जी नमस्कार.
नमस्कार प्रमोद जी, यू आर नॉट विजिबल, आप दिखाई नहीं दे रहे.
हाँ
हाँ, यस प्लीज जी.
नमस्कार डॉक्टर के वर्मा जी,
नमस्कार.
आदरणीय श्री विवेकानंद जी. एजुकेशन की चर्चा के इस 98वें सत्र में हम लोग बैठे और अमूमन समाज को दिशा देने वाले व्यक्तित्वों की जो उनकी आंतरिक गाथाएं हैं और उनके द्वारा किए गए समाज के अवदानों, समाज से हुए इंटरैक्शंस को समझने की कोशिश सहजता, सरलता और समयता से करने का प्रयास आदरणीय श्री विवेकानंद जी करते हैं. उसी कड़ी में आज डॉक्टर ए.के. वर्मा जी, जो शिशु रोग विशेषज्ञ के रूप में ख्याति लब्ध हैं, उन्होंने भी किया. प्रारंभिक शिक्षा उसकी कठिनाइयां, जबलपुर में ठहरना, अपने शिक्षकों को याद करना, उन शिक्षकों से सीखी गई बातों को समाज में सदुपयोग करना और फिर जहां जहां जो जिम्मेवारियां मिली उन जिम्मेवारियों के साथ अपने आप को ढाल लेना एक अद्भुत समन्वय का कार्य होता है. इस तरह के व्यक्तित्व को गढ़ने में उस व्यक्ति को बहुत ही कठिनाई होती है, क्योंकि हम आप सभी जानते हैं कि प्रत्येक पल, प्रत्येक क्षण, हमारे यहाँ तो कल और विकल तक की व्याख्या है काल गणना में. उस समय प्रत्येक पल जो मन अस्थिर, विचलित, बहुत सारी आकांक्षाओं और अपेक्षाओं और बहुत सारे उद्वेगों से गुजरता रहता है, उसको संभाल लेना, संभाल के खुद को उस पर चला देना और चला के उसको आगे बढ़ा देना, ये कला ही हमें सफल बनाता है. और मैं समझता हूँ आदरणीय ए.के. वर्मा जी इस कला को साधने के प्रयास में बहुत हद तक सफलता की ओर बढ़ रहे हैं. इसीलिए इनकी सौम्यता, सरलता, सहजता जो न केवल इनके व्यक्तित्व को निखारता है, बल्कि मेरी अपनी समझ ये कहती है कि जिस प्रकार के रोग से ग्रसित बालक और उनके माता पिता व्याकुल होकर इनके पास आते होंगे, तो आधी बीमारी तो इनसे बात करके ही समाप्त हो जाया करता. ये एक सहज सरल स्वरूप में उन चीजों को समझते हैं और उसे कहते हैं. दूसरी एक महत्वपूर्ण बात है कि कई केसों में अपने यहाँ की परंपरा रही है कि बालकों को उसकी दादी और नानियां उसको बड़े अपने अनुभव से संभाल लिया कर. लेकिन 21वीं सदी की जो माएं हैं और एकल परिवार है, इस एकल परिवार का जो दुख है वह हम सभी जानते हैं. जानते तो हम लोग सबको ही हैं, लेकिन समझते डॉक्टर वर्मा ही हैं. उस एकल परिवार का जो दंश होता है तो किस प्रकार से इनको उसका सामना करना पड़ता होगा, क्योंकि माओ को कुछ पता नहीं होता है. वो एक्सीडेंटली, कई तो ऑर्गेनाइज्ड मदर होती है, कई एक्सीडेंटल मदर हो जाती है. और जो एक्सीडेंटली मदर हो जाती हैं उनकी मानसिक व्यथा और उस बच्चों से जो स्नेह और सौहार्द और ममत्व होता है, उस दूर दूर तक उन चीजों का पकड़ उनके माता पिता को नहीं होता है. इसीलिए प्रत्येक क्षण, प्रत्येक पल एक सलाहकार चिकित्सक की आवश्यकता होती है. और मुझे लगता है कि डॉक्टर वर्मा से उपयुक्त शायद अभी इतनी सहजता से मिलने वाले लोग बहुत कम होंगे. और मिलते भी होंगे तो उस भीड़ को, मैंने उस भीड़ को देखा है, उस भीड़ की पंक्तियों की व्यग्रता को देखी है। और अपने यहाँ की कुछ चिकित्सीय व्यवस्थाएं अब तो मॉडरेट हो रही हैं, स्पेशलाइज्ड हो रही हैं और सुपर स्पेशलिस्ट हो रही हैं, जैसा कि आपने भी कहा है। तो जो मॉडरेट हो रही है, जो स्पेशलाइज हो रही है, जो सुपर स्पेशलिस्ट की ओर जा रही है, वो अब चिकित्सालय एक सामान्य चिकित्सक का एक छोटा सा कमरा नहीं रहता है, वह एक पांच सितारा होटलों की तरह चमकता हुआ एक जगह होता है। और उस जगह, चमकते हुए जगह में जो अपेक्षाएं होती हैं, जो चिकित्सा के लिए दिए गए जो स्वरूप, जो उसके बदले अदा की गई राशि होती है, उन अदा की गई राशि से कई हजार गुना ज्यादा की अपेक्षा उनके दिमाग में होती है। और इसका पूरा किया जाना कठिनतम चुनौतियों के सामना करने के बराबर है, जिसमें अध्ययन, अध्यापन, अनुभव, सहज और सरल स्वभाव, ये सारी चीजों का मेल जो आदरणीय श्री डॉक्टर वर्मा जी के पास है, उसको लेकर के निश्चय ही बहुत सफलता के साथ आगे बढ़ना है। और मैं अपने हृदय से आपको मंगल कामना देता हूँ, आपके प्रति अपना सद्भाव व्यक्त करता हूँ। जो जरूरत हमारे समाज को है, आप उसका संरक्षण कर रहे हैं। आज के इस 98वें सत्र में आदरणीय श्री विवेकानंद जी, जो बड़ा ही व्यग्र विद्वान, बड़ा ही दृढ़ विद्वान व्यक्ति, जो इनके लगातार प्रयासों के बाद भी कई प्रकार की कठिनाइयों और कई प्रकार के झंझावातों से गुजरता हुआ यह एजुकेशन पर चर्चा अब अपने 100वें सत्र की ओर बहुत तेजी से बढ़ रहा है। उस 100वें सत्र पर हमारे देश के प्रख्यात लेखक, पब्लिक इंटेलेक्चुअल की हिंदी क्या होनी चाहिए, मैं बहुत दिन से ढूंढ रहा हूँ, कभी विवेकानंद जी ही मुझे बताएंगे। शायद इसकी हिंदी ये होनी चाहिए, समाज विज्ञानी या सामाजिक विद्वान, ऐसा कुछ होता होगा, लेकिन मैं अब उसके ढूंढने के चक्कर में नहीं पड़ता हूँ। लेकिन मैं इतनी बात सार्वजनिक रूप से इस आभासीय माध्यम में स्वीकार करता हूँ कि आदरणीय श्री विवेकानंद जी जिस सारस्वत साधना की ओर बहुत व्यग्रता से लगे, भगवती इनकी चेतना को शुद्ध और सौम्य बनाए, सरल बनाए और उस ओर लगातार ये बढ़ते रहे। जीवन के चक्र में जितने झंझावातों को देखने का अवसर सामान्य मनुष्य को मिलता है, वो एक चुनौतियां हैं, जैसा कि डॉक्टर वर्मा भी कह रहे थे और आदरणीय विवेकानंद जी भी कह रहे थे। मैं मानता हूँ कि आज के इस अवसर पर, जबकि हम और आप एक वेदना से ग्रसित हैं, जहाँ हमारे ही भाई बंधु कोरोमंडल एक्सप्रेस के इतने भयावह दुर्घटना में चले गए हैं और दुर्घटनाग्रस्त लोग अभी अस्पतालों में अपने स्वजनों को, परिजनों को ढूंढ रहे हैं, वैसे अवसर पर यहाँ सहानुभूति और संवेदना के साथ अपने बड़े ही प्यारे आदरणीय प्रधानमंत्री जी उस जगह को देख कर आए हैं और बहुत चकित हैं। मैं समझता हूँ उन सभी को अपने हृदय की वेदना से प्रणाम करता हुआ, शीघ्र स्वास्थ्य की मंगल कामना करता हुआ अपनी बात को विराम देता हूँ और विवेकानंद जी को आमंत्रित करता हूँ।
Thanks a lot. Thanks a lot, Pramod ji, for all the erudite words that you spoke. Indeed, I am so thankful to our very, very distinguished guest today, Verma ji, for giving us very, very invaluable time and for enlightening, for illuminating today's education pe charcha. My dear viewers, a very important announcement today on the, in the wake of centenary celebration of education pe charcha. I, being an author of the pioneer book in the world, The Living Legends of Mithila, and its Hindi version, Mithila ke Adunik Diggaj, we are going to, after a detailed brainstorming and churning out, we have decided to document the education pe charcha by bringing the book of this particular pattern of that is the living legends of Mithila. We are going to portray at least 40 of our topmost achievers on education pe charcha. So this book we are going to charcha after its of 100th of session on education pe charcha. My dear viewers, we have had a very session today. Just to catch my announcement, which I already made in the beginning of our session, Rizwan Khan, Sri Rizwan Khan, the chairman of the Hajj Committee of Jharkhand, and he is a very important member of Muslim Rashtriya Sangh. He is going to be our distinguished guest on 10th of June 2023 at the same time at 7. And I thank to all my esteemed viewers, because this is on account of their patronage, their sincere interest in education pe charcha, we are able to carry on with this show. So I'm really thankful to our all our viewers as well. And of course,
विवेकानंद जी वो मुस्लिम संघ है कि मुस्लिम मंच है, राष्ट्रीय मुस्लिम मंच है?
a Muslim month. Yes. I'm so thankful to promote for correcting me. It is Muslim month. So Sri Rizwan Khan will be our distinguished guest. And once again, thanking our distinguished guest, Dr. A.K. Barma from the core of my heart. I return, and of course, Sri Pramodji, a very partner of education. I return all of you to the studio with the commitment to be back on next Saturday at the same time, that is at 7 p.m. with our distinguished guest, Sri Rizwan Khan. Thanks to all of you. Thank you. Thank you, Dr.
Thank you.